Hello, everybody. Welcome back to another session. Today we have Aalapti here. So she's a psycho-oncologist, and thank you very much for being here. It's a pleasure to have you. It's wonderful that you joined us. Thank you.
Hi, Lakshit. It's a real pleasure to be joining here with you, and thank you so much for calling me and inviting me and having me do this.
It's my pleasure, ultimately. So before starting up the session, it would be great if you can speak about yourself and what you do, and then you can add upon what you think is mental health according to you and how to define mental health. That would be great.
Great. So, as you rightly said, I am a psycho-oncology researcher. So, currently, I'm pursuing my PhD in the same, and my thesis work basically involves um, imparting cognitive behavioral therapy to breast cancer patients and basically screening them for cancer related distress and then giving them cognitive behavioral therapy and then evaluating the difference. And basically, the ultimate goal is to relieve their anxiety, depression, and stress in the end. This aspect of mine. Another aspect is that I am a trained Indian classical musician,
Yeah.
and even there, I'm habitual to finding out the uncommon and the unconventional, and I think that is somewhere what has reflected in my study part also. Otherwise, I am an explorer. I really need to have scientific adventure at all the time, and I cannot really, go redundant. So, what is mental health according to me? That is what you asked. So, I say it is something that you should not have to get it from outside. It should come from within. And if you're not really reverberating yourself with that, it's absolutely no shame to get help. When I say it should come from within, so what exactly does it mean? So these days, we see mental health is mostly related to comparing yourself with others.
Hmm.
Either on social media or at work, social media primarily, or we have some very, very, very illogical standards from celebrities or from the Western world, which do not match with us. And this is the major reason why mental health is suffering. So there should not be a comparator for our mental health. Mental health is basically peace of mind or accepting things as they are and moving ahead.
Hmm.
And this should come from within. But if you are not able to really process your feelings, or you're having trouble with things that go around you, or you're noticing something which is not normal about you, so there should be, I repeat again, absolutely no shame in taking external help.
Okay.
It could be it, it could be a therapist, it could be a counselor, it could be a clinical psychologist, it could be a psychiatrist. But one thing that I want to say here very importantly is, these days, you see people talking and you see people posting on social media that I am there for you, my door is open, please come and talk to me.
Yeah.
So it's okay up to some extent to
Yeah.
go and talk to someone.
Hmm.
It definitely helps,
Yeah.
but that is limited to only venting out.
Yeah.
But what next? So
True.
when that person is not capable to help you further, only venting out will help only to some limited extent.
Yeah.
It will not help you process your feelings, it will not help you get better. So this is not, it happens a lot. I get a lot of DMs, I get a lot of messages that ways and this ways and that ways, and I've discussed it with a lot of psychologist friends of mine. So all of them come up with the same problem, that people want solutions on DMs these days,
Yeah.
which is not the case. Which is not the case. So you really need to invest time, you need to invest yourself in getting better.
Hmm.
So on the whole, this is what mental health stands for me.
Okay, great. It's really, to be truthful. This would be one of the most precise. I would not quote it as precise. Different one, and really unique one of putting mental health as. So thank you for that. Really impressive. Loved it. And taking to the next question is, you are a specialist of psycho-oncology. So what is that subject all about? What is it?
So, psycho-oncology or psychosocial oncology, the words in itself are meaningful. So, basically, we are dealing with the psychological aspects of cancer.
Okay.
So this is not only limited to cancer patients, but also with their family, with their children, with those who have fear of recurrence. So it's basically a discipline which is it's a multidisciplinary system which works not only with the emotional or the psychological aspects.
Mm-hmm.
It includes the physical manifestation of psychological aspects as well as spirituality, religion, quality of life, stigma, desensitization, sensitivity towards things, and all that. Also, it not only involves just a psychologist or a
Mm-hmm.
psycho-oncologist.
Mm-hmm.
It is a good big team of a counselor or a psycho-oncologist or a social worker with the patient's oncologist, with the family member, with the caregivers. And it is not only limited to taking care of the patients per se,
Mm-hmm.
but
Okay.
it also takes care of their family, their
Okay.
close friends,
Mm-hmm.
people who are involved in taking care of the patients. And also, one of the most ignored areas is the mental health of the oncology staff, which
Mm-hmm.
includes doctors, nurses, radiation oncologists, chemotherapists, nurses, and social workers, and like so. Because this is the group of people who is facing death on the daily, and they get no time to grieve, they get no time to get over one loss, and they have to be positive for another
And the one,
patient.
yeah, yeah.
Yeah. So this is one of the most ignored areas of psychosocial oncology. Also, psychosocial oncology these days is coming up with something called as preventive psycho-oncology. So there we deal with people who have genetic risk of getting cancer. Or preventive psychosocial oncology is also used in head and neck cancers where there is a lot of tobacco abuse or substance abuse, right? So people who tend to be predisposed towards the genetic cancers, if they get tested, they tend to have a lot of anxiety and stress about it, and they keep stressing about it.
Mm-hmm. Mm-hmm.
Sometimes people may even take some adverse steps, like we know the celebrity who got a double mastectomy and a oophorectomy and a hysterectomy just to avoid cancer only because she had a positive gene, but that was not indicative whether she had cancer or not.
Okay.
So people these days, even I think it was Angelina Jolie, if I'm not wrong. So people these days start getting worried a lot, and they even go to doctors with decisions, with adverse decisions like this. So preventive psycho-oncology also deals with these aspects where we can, really realign the thoughts of these people and
Okay.
make them understand their risk factors, keep in
Okay.
check with the doctors timely, and make them understand that they do not really have to go through these steps, but they can take care of themselves following some systematic way of getting checked like
Okay.
that.
Okay, great. And how do you think it's different from the normal psychology? What makes it different?
Well, here we only cater to anything related with cancer.
Okay. Okay. Okay.
So that
And
is how it is different.
and how do you think a psycho-oncologist deal with patients keeping it with oneself and not expressing their thoughts and emotions? Like it's very very hard to what you speak, what what the person is going to just keep it with yourself, because it's a human nature. It's not about anything. It's just human nature. You share things. It's sometimes it's about privacy and all those things. But how do you think they keep it with themselves?
So see, there's always the point of confidentiality
Yeah.
that we are bound to keep. and in no case do we ever put it out. So that was always there, and that's the same with everyone related to any medical sciences, I think. So that is something that someone should not be concerned about, because we will never give out information unnecessarily. And when the patients come to us, we also ask them that what amount of information do you want to pass it on to your family or to some trusted person, as they would want to. Sometimes families come to us and they say that please do not tell the patient their diagnosis, which is really not possible. And I personally really advocate that this is one thing that should not be done.
Hmm.
We've seen some bizarre cases regarding this. Maybe if we had more time, we could have discussed. I'll just discuss one small example with you. There was a 75-year-old male, a very educated person. He had bone marrow cancer. And so he used to have a lot of backache, back pain. Uh, he was being taken to a chemotherapy center every week, but was not told his diagnosis that he had cancer.
Okay.
And that educated person would be taken to the chemotherapy center. He would read the signboard there on the hospital which said XYZ chemotherapy center. And his family just told him that it's just for your backache.
Okay.
So can you even imagine the kind of turmoil that person, and the
Yeah.
kind of confusion that must be going on in that person's mind?
Yes.
So I really advocate, and most of the psycho-oncologists and the oncologist advocate that you should never hide the patient's diagnosis with them until and unless there is something very crucial that's coming up. So we can hide it for a little amount of time, but not for always.
Okay.
That's even true with children. That's
Okay.
even true with children. Even pediatric psycho-oncologists always try to convince the parents to break the diagnosis to the child in a palatable manner, because a child, for that matter, has a lot of curiosity at that time, has a lot of energy. So they have questions about, why am I not able to do the things like my friends are doing,
Yeah.
right?
Yeah.
So how do you explain it to them? How do you explain that you're losing your hair, whereas your friends can enjoy their hair like anything? They can
Yeah.
style it in different manner. Why can you not go out and eat ice creams and pizzas and pastas all the time, and you have to be on salads or good diet, and your friends can party all the time?
Yeah.
So it's important even for parents to break the diagnosis to children. So that is how confidentiality comes in play. So this is something that we advocate to tell the patients and their families. But on the other hand, when it comes to expressing emotions, it is something that is totally up to us. There is a clean, fine line which we cannot ever cross.
Okay.
We will never, ever, ever, until the patient says, or until judged otherwise, if there is something very dire that needs to be discussed and the patient is not wanting to, we would never ever share any personal information with anyone.
Okay. Okay.
As for expressing emotions, so I think there are some difficult patients, there are some slightly not difficult patients. So it's just a matter of building rapport with them. It's just a matter of making them realize that we are not there to judge. It's just a matter of making them comfortable in that space and with your presence. And every person, every therapist has a different way of doing it. There are even some tough nuts who do not speak up for 4 or 5 hours together, for 4 or 5 sessions together. So the best way to do is like, okay, you don't want to speak anything, don't do, but you have to sit here for 45 minutes. You have to do that. So you keep watching the walls, you keep watching the aquarium, you keep doodling something, you do anything that you want to do, and there is 100% success in that matter. 4 sessions, 5 sessions, 8 sessions, 10 sessions, but the person will break.
Yeah. Yeah. True.
So the basic is to provide them a comfortable, non-judgmental space.
Okay. 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 I just have a question of the point. Just being a bit of devil advocate here, I just wanted to add put up a question here. So we have these politicians telling that we're gonna work for the betterment of this society and betterment of the people. but they never do, right? So how do you think, because it's a human nature, it's nothing bad against the profession or something, I just want to ask question, how do you think, do you even come up with these kind of problems, that there are some people who there are some psychologists or oncologists who say we are going to be confidential, but they go on sharing their information? Do you come even in such cases also? Because it's human nature, it's not about any profession, it's human nature. So I just want to ask about that.
It does happen, unfortunately, it does.
Okay, okay, no worries. Yeah, just wanted to know, because I've been hearing this, that we keep things confidential and nothing happens. So I just wanted to just wanted to become a bit of devil advocate. Uh,
Yeah, yeah. Unfortunately, this does happen. It's a very unfortunate situation, but very rarely though. But yes, it does happen.
okay, great. So next
Again, it's
question.
nothing to be scared of.
Yeah,
It's
yeah,
nothing to be scared of. Yeah.
yeah. True. So this question was there, that what does a patient has benefit if he or she visit a psycho-oncologist?
So we're basically aiming to first of all desensitize them about the stigma of cancer,
Hmm.
because the moment you hear the word cancer, we equate it to death,
Yeah.
or we equate it to end of life, right? So the first thing to do is to desensitize and normalize them about cancer. One
Okay.
of the big things is the unanswered questions of patients, because clinicians usually do not have that much time owing to the patient to doctor ratio in India. Clinicians actually do not have that much time that they can answer a lot of questions for the patients. So
Hmm.
mostly what happens is there are a lot of unanswered questions which we term as unmet needs,
Okay.
right? So those unanswered questions create a lot of anxiety, they create a lot of stress. So step number one, if you're able to answer those questions to the proper length as the patient wants, the
Okay.
stress reduces, the anxiety reduces, right? uh, then when there is reduction of anxiety and stress, it is seen that you would adhere to the treatment in a much better way.
Okay.
Because with a cancer diagnosis comes a lot of shock as well as denial,
Mm, mm.
right? So denial is a huge part where you say, oh no, I cannot get it.
Yeah. Yeah.
I've been very healthy. I do not drink, I do not smoke, I exercise, I eat right. I cannot get cancer. That's not possible. Oh, I'm not accepting this diagnosis at all. Also, with a lot of shock, sometimes when people are diagnosed in the end stage or in the third stage or like that, so they just say that eventually I have to die, so why do I take the treatment? Why do I waste so
Oh,
much money?
yeah.
Why do I take so much pain on myself when either way I have to die? So this is one of the things that you really need to work upon, and this improves the adherence to treatment
Okay.
and possibly a better survival rate also.
Mm, mm, mm.
Third thing is the quality of life.
Okay.
Because with a lot of treatment, with a lot of radiation, with medicines, with surgeries, with chemotherapy, there's going to be a lot of impairment in body movements. You're going to be in a lot of pain, you're going to be weak, you're going to be not sturdy at all times. So the third aspect is quality of life.
Okay.
So with quality of life, you need to make the patients physically as well as mentally capable and able to be doing their at least day-to-day activities.
Mm.
So that may involve running your household errands, doing your daily chores, tying your laces yourselves,
Mm-hmm.
uh, ironing your clothes yourselves.
Yeah.
So that is another thing. Uh, Another thing is a rehabilitation.
Okay.
So especially in cancers of the limbs, where one unfortunately may have had to lose a limb, or they must have lost their job because of the expenses or things like that. So making them go back to a job where they can earn, where they can earn their bread, where they can earn their life back. So rehabilitation is another part of that. So basically, it's a reduction of stress, desensitization, normalization, uh, improvement in quality of life, better adherence to the treatment, possibly a better survival rate also.
Okay.
There's one thing that I usually say, and I am sometimes ridiculed for that. I'll say it in Hindi, I'll say it the way I say it. I say cancer एक बहुत बढ़िया बीमारी है.
Okay. Why? And why do you
You
think
know
that?
why?
Yeah,
And
that.
why do I think that? If someone gets hypertension, they have to be on meds their entire life.
Hmm.
If someone tests positive for diabetes mellitus, they have to be on meds for their entire life.
Okay.
For something as simple as thyroid, hypothyroidism, you have to be on that thyroid pill for your entire life.
Okay.
But with cancer, if it is caught early and at the right stage, and if you get the right intervention, you can live an absolutely medicine free life, an absolutely non restricted life for the rest of the period.
Okay. Okay. Uh-huh.
But the condition is you need to catch it early, you need to get the right intervention.
Mm-hmm. Okay. Okay. Great. Okay.
That is
Fine.
how I, yeah.
Okay. Thank you for that. And I just wanted to ask you a question: is what kind of denial questions do you expect? No, not expect. You get from the patients.
Denial is and one thing that I told you that mostly
Yeah.
patients would come that I eat healthy, I don't
Yeah.
smoke, I don't drink, I don't consume any substances like that. Why did I get cancer?
Okay.
That is the biggest part. So you really have to make them
Mm-hmm.
realize that lifestyle, yes, it does contribute to your predisposition or the risk factors towards cancer, but that is not always the case. So a person who has never had a single alcoholic drink can still get liver cancer.
Okay.
A person who did not smoke a single cigarette their life can get lung cancer.
Okay.
So these are some things that nobody has control over. No
Mm.
one has control over.
Mm.
So this is something that you need to put it out in um, layman statistics, or you have to put this out in layman language, and you have to be very empathetic and sympathetic about it, where you can do. Second part is, with the denial comes a lot of blame. Now blame is two types. One is self blame, another is blame on God. Why
Yeah.
did God
Yeah. Yeah.
why did God punish me with
Me.
cancer?
Yeah. Yeah.
And another is self blame. People who had the habits of drinking or smoking, or who did not exercise, or who did not eat right, or were into a lot of oily junk food, or drank a lot, had a lot of tobacco or smokeless, chewable, whatever smoking, they blame themselves that
Mm.
maybe I could have done better. Maybe
Better.
I listened to my wife. Maybe I listened to my parents.
Yeah.
You know,
Yeah.
so that is another thing that you have to really put it forward, that what's done is done. Now you can't change it.
Yeah.
And then you have to tell them that even if you did not do all these practices, there was still a 50% chance or an X% chance that you could have had cancer.
Mm-hmm.
So these are also some of the issues that usually you face when a diagnosis is broken to a patient.
Okay. Okay. Great. Thank you. And do patients have routines? And if yes, then how do you implement those routines on patients who are very hard to make them understand? Patients who are very tough. How do you make them get on to these routines and all those things?
So there is no one perfect way of doing it.
Okay.
That's basically, you have to break into that patient's psyche and understand what works best with them.
Ah, okay. Okay.
So, for example, one patient may not agree to write a journal every day,
Okay.
right? So, you have to find out what is that one thing that interests that person. So you pick that up with them.
Okay.
So this is one thing that has to be very personalized. There cannot be a baseline with that.
Hmm.
That has to be very personalized and very much tailored.
Okay. Okay, great. And now I just wanted to get into the part of the patient's family and all those things in patients. There are some families where some person gets cancer at a very young age. So how do we get children's engaged in these difficult conversations regarding cancer and telling them that your father or your mother or your grandfather, your grandmother, or anybody from whichever whomsoever is very close to those children's, how do you tell those children's that this person is cancer and maybe he could survive or maybe he could die? How do you get that and do that?
I'm very glad that you brought this up because this is a very sensitive topic and something that I advocate for very much. Because especially in Indian families, we have a habit of keeping the children away from difficult things.
Yeah. Hmm.
But uh, children are very observant, extremely observant. They're very curious and inquisitive. They want to have answers to everything going on around them, right? So when they see their loved one, when they see their father or their mother or their grandmom or their grandpa deteriorating in physical health every day, they see them getting weaker, they see
Hmm.
them losing their hair,
Hmm.
they see them sometimes, vomiting blood, they see them fainting. So there's obviously a question that what is happening with them. So what do you tell the children? Are you just going to lock them up inside a room and say, no, 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 everything is going to be fine?
No.
Where eventually everything is not going to be fine.
Yeah.
So you need to involve children in difficult decision making. And you know what? Children have an eternal power of resilience.
Yeah. Yeah.
They're small, they have limited but exceptional capacity.
Hmm.
So they can really, really, really digest things well
Yeah.
if explained to them in a very good manner.
Manner. Yeah. Agree.
If you involve them, they would rather help. They would rather help, and they'll be more, careful about you. They'll help in doing things. They'll help in, doing some daily practices for the one with cancer.
Yeah.
So it's very important right on, and it's not only related to cancer. I say it's very important to build resilience in children.
Yeah.
So much so that if you take a child to a toy store, let them understand that each time they visit a toy store, it is not important that you buy them a toy every time. It's okay to just have a look and come back.
Yeah.
That's just the first step towards building resilience and the first step to practicality, basically.
Hmm. Hmm.
So it's see, for a child, even the tearing of the eye of their favorite teddy bear is a big loss,
Yeah. Yeah.
or a severed Barbie head is a big loss.
Yes.
So so if something that small affects a child so much, what do you think would happen to them if they lost someone they loved a
Love.
lot?
Yeah.
Huh? So
Yeah.
so it's extremely important that you involve children.
And even that saying that, as you mentioned, I just wanted to add upon thing, is today's children's, like we or maybe your generation, we were I would say we were like I should not use this word, but I think that's the right word which I get in my mind right now, is we were stupid. We knew nothing about what's going on. We were just like, mummy ne ye bol diya, papa ne bol diya, wo karo. That's all it. Today's kid, he knows to use a phone. At the age we didn't even know what is phone. So that is today's kid. So it's totally a different thing. They know, they can, if you don't even tell them, they'll understand it. they will get to know what's going on, even if they don't know what's cancer, they'll get to know what's happening with the person. So I think
That's very true.
it's impossible that you make them you know tell them lies and hide things from them, because it's impossible to hide things from them. It's impossible, I believe.
It's impossible. In a closed wall, a four-walled house, how much can you hide from
Yeah,
a member? You
yeah,
cannot.
you cannot. True,
You
true.
can't.
Yeah,
That's
yeah,
that's very true. Children these days are very exposed.
yeah,
We were blinds.
yeah.
We just blindly followed our parents. We
Yeah,
just blindly followed our elderlies.
yeah, yeah,
Our generation knew nothing.
true.
These days, when I see 3 years, 4 year, 5 year olds, I am in awe. I am
Yeah,
shocked to see their level of exposure
yes,
versus what we were at the same age.
yeah, yeah, yeah.
So it's that's very true what you put
And then
up.
even that, I just sometimes feel like, we have like I see them and like, मैंने क्या कर लिया, देखो इन लोगों को क्या कर रहे हैं." It's that, sometimes, yeah, that's a total different conversation we're getting into, but I just want to get back to the conversation on. So there is a person, there are sometimes, there are person who says that I'm going through these issues all my life, and I just don't want to get into another procedure or another treatment. So it's better than, I'll rather die than getting into something else. So how do you respond to that person?
So for that, we need to involve the clinician first of all.
Okay.
One thing that I really want to put forward is a psycho-oncologist never works alone. They always work in sync with the clinician, with in sync with either the surgeon or the medical oncologist.
Yeah.
So here is where the major role of the medical oncologist will come into play, where they will put out statistics in a manner where the person can understand. They'll put out the survival rates. They'll put out the prognosis in a manner that the person is convinced. At this point of time, we can have something called as group therapy. So, where people who have undergone the same experience, people who have had the same experience, share their views and the
Okay.
way they got through that experience in their life,
Okay.
which can actually help the patient currently in problem absorb things and digest things and probably understand things in a much more practical manner, because the doctors can say but the patients suffer.
Yeah.
Yeah, so they can probably put out the best and the most practical ways of how they dealt, what they felt, how they dealt with the problems, and if this is the right solution, the right way to go. Finally, the decision is always that of the patients,
Yeah.
but we can do our best to convince them that ways.
Of
So
course.
it's sharing of experiences, support therapy, group therapy, a lot of giving them the right amount and the right kind of information at that time is crucial.
Hmm. Hmm. Okay. And that's this one thing I would like to ask. Do you have any what do you say, any what do you say, how would any past patients which you remember, which were different, which you think people should know about, and which could help them or their family member in any way, or that story could help somebody?
Well, this is something that would be unethical on my part right now, because I am bound to
Okay.
a place. I'm bound to my work ethics right now, so I will not really be comfortable sharing such stories.
Okay.
But definitely at a later date, we'll definitely discuss such
Sure,
things.
sure, sure. No worries. I'm. It's okay. It's okay. It's all fine. Okay. Next question. Bringing me. Would you like, just, if a person goes, a patient starts to behave abnormally, is there any quick first aid which could a family member use to help him or her out?
Yes, we do have such quick aids. We have mental first aid also. So
Okay.
there are a lot of techniques that one can go through.
Mm-hmm.
There are a lot of techniques that one can actually get help with. They would involve visualization or guided imagery or some good deep breathing exercises.
Hmm.
Something as simple as going out, taking a walk in the open. That also differs from person to person based on their likings and their ability to do that task. But something that really works very well that I have seen in person is visualization or
Hmm.
guided imagery.
Hmm.
Where, for example, you are very anxious about what is going to happen in my next chemo session, because the past chemo session gave you a lot of pain in the arm or a lot of
Hmm.
pain in the port that was put in,
Mhm.
and you really do not want to go through that again.
Yeah.
And 1 or 2 days before having that session, you are very anxious and you're very stressful and you do not want to go through that again, and suddenly you have a panic attack. So what can you do at that time, or what can your family member do at that time? They can sit you down, they can talk you down,
Hmm.
take some deep breaths, close your eyes, imagine a place of your liking.
Hmm.
you know and sometimes, you can imagine a beach,
Yeah.
like you're sitting on the beach and you're seeing the waves of the ocean, and you try to visualize, you try to uh, mm, imagine the kind of smells the ocean have, and the kind of creatures that will be around, the environment that will be there, and you try to calm the waves of the beach, calm down the
Mm.
waves that are coming to the ocean. So that will have a good effect. Another thing is guided imagery or visualization in a manner that you imagine any object or any creature for once. Like, what I do mostly is I say that there is a fish inside which is eating away all the diseased cells,
Mm.
which is fighting away all the diseased cells. So, you can close your eyes and you can imagine that fish moving around inside your body and eating away all those cells. Some people have a problem with imagining fight, they relate negativity to it.
Hmm.
So, you can rather introduce a flower which is inside you, which is creating normal, healthy cells.
Hmm. Okay. Interesting.
Yeah. So these are some mental health first aids or some psychological first aids that one can get help from in case of a psychological emergency.
Okay. Okay. Great. Great. And this question I had is, it's a very tough time for the family. It's a very tough time for everybody near them, through them, and it's very very hard that people communicate. It's important, but it's hard. Just to be truthful, it's like somebody would say no, it's not, and we have to communicate. Of course we have to communicate, but it's hard. It's really really hard. It's already, there's so much of mental trauma, there's so much of mental tension going on. The person who love them or the life partners are going through so much of things in their mind already. So what do you think the family members need, and how can they deal with it?
Absolutely right. So the first thing, this question has actually two aspects to it.
Mhm. Okay.
First is communicating with the patient,
Okay.
and second is taking care of themselves as family.
Mm. Mm.
Right. So, part A, communicating with the patient. Point number one, I am dead against preaching be positive and everything will go fine.
Yeah. Okay. I support you.
I'm absolutely against it. These are the few words that a patient at that time does not want to hear,
Mm. Mm.
because they are the one who is suffering and they know positivity is not helping them.
Yeah.
They know everything is not going to be
Mhm.
fine.
Yeah. Yeah.
Yeah? They are going to suffer a lot, they are going to go through a lot of pain physically as well as emotionally. So this is not the time to preach the positive mantra. Rather, you as family or the close friends can be open about your emotions even to the patient.
Okay.
You can clearly go and sit down and tell them that, see, I do not know what to do.
Okay.
I do not know how to talk with you,
Mhm.
talk to you.
Mhm.
I do not know. what will make you feel comfortable.
Mhm.
So why don't you tell me what do you want,
Yeah.
right? This will create a parallel, comfortable sense in both the patient as well as the family or the friend, where they can understand that, oh, even he is going through the same thing. So probably it will be okay for me to express my feelings at this point of time,
Hmm.
right? Another thing, we have a habit of saying, call me anytime, I'm there for you.
Yeah. Yeah.
But there's a hesitation on both the parts.
True.
The patient will never call you at 2 a.m. in the morning until in dire need.
Hmm.
They'll always think, oh, that person might be sleeping at that time,
Yeah.
right? And you, who has said, call me at any time, I'm there for you just keep saying it but never do anything about it.
Hmm. Interesting.
Rather, rather, show them this emotion of yours, show them this expression of yours by practically doing something for the patient.
Hmm.
That could be something as simple as cooking them a meal,
Okay.
getting them groceries, taking them to a doctor's appointments, filling up their prescription, getting their laundry done,
Okay.
but do something practically for them.
And maybe even we can add upon giving them a call.
Giving them a call, checking upon them once in a while,
Yeah.
even if they don't want to. And yes, with checking upon them, there's one very important thing that comes in play, that please do not expect the patient to be vocal at all times,
Hmm. True. True.
right? You may be wanting to um, get them involved in a lot of social activities or getting them to talk a lot, but they might not have the
Not.
bandwidth to do that at all times.
Yeah.
So give them their own space. Yes, do not let them sulk into it,
Okay.
but allow them their me time, allow
Yeah.
them their own personal space
Peace. Hmm.
where they introspect or do not introspect or do nothing,
Hmm.
but allow them their own time.
Yeah.
But also do not stop checking upon them.
Yeah. True. True. True.
Even
Really
if
true.
they abuse you, even if they abuse you on the phone call, just say, okay, tomorrow is going to be a better day. Let's talk tomorrow.
Talk tomorrow. Yeah. Yeah.
So this, and the second aspect of it that you mentioned is the families themselves. How do they take care of themselves? Because we see a lot that the family goes through a lot of emotional turmoil. They have a lot of trouble absorbing and digesting the fact. They have to adjust to new things and learn new things very quickly. Their life changes absolutely. It's a turning point for them. So personal relations get affected, personal care gets affected, their own health gets affected,
Yeah.
their jobs may get affected, their finances may get affected.
Hmm.
So the topmost priority is take out 15 minutes, only 15 minutes for yourself in a day.
Hmm. Hmm.
That could be just sitting with a cup of tea in the balcony,
Hmm.
or that could be dancing to your favorite song
Yeah.
in a closed room, or that could be having a hot shower.
Yeah.
Anything but 15 minutes to yourself in a day. That could be meditating, exercising, dancing, eating, or even cooking yourself your favorite sweet dish and having it alone. Making halwa for yourself today and you'll have it alone and no one else can have it.
Have it. Yeah.
That's perfectly fine, but you need to do that because self care is priority. If you yourself are not okay physically and emotionally, you are going to lose yourself. You're going to lose your capacity to take care of the other person,
Person. Yeah. Yeah.
right? Second thing is communication within the family, apart from the patient.
Okay.
So the same concept works here also, right? If the father is has cancer,
Mm-hmm.
and there are two brothers, and the
Mm-hmm.
brothers themselves do not know how to communicate with each other, why not communicate this feeling with each other that we do not know how to communicate?
Yeah.
Maybe at some point of time, someone comes with some solution.
Yeah.
Or,
True.
you just speak up one day and even the second person connects to it.
Hmm. Hmm.
Same thing is with children in the family.
Okay.
So, communication, self care are priorities.
Hmm.
Third thing, if you are still not able to take care of it, we support group therapies or support or self help groups.
Okay.
So, even family members and caregivers have support groups and advocacy groups where they share their own experiences of dealing with a cancer patient in their lives.
Okay. Hmm.
So, that is another thing that one can do.
Okay. Okay. Great. So before ending up this session, would you like to speak upon anything or add upon anything, or maybe if not, you can just end up with a last message, and we can conclude this session.
Well, um, I really believe that more of us come together and firstly remove the stigma related to cancer as well as mental health in India.
Yeah.
Because with the exploding numbers of cancer and the exploding incidence and prevalence of cancer in India, we really need to put mental health practices in place,
Hmm.
because we are starting to see a very positive graph in this aspect. So please, getting mental health support is not being tagged mad.
Hmm.
That is the biggest thing one should, really rub it off on their minds, rub it from their minds. And one positive scenario that is coming in place is when our celebrities are starting to endorse mental health.
Hmm.
So, though it is becoming a trend, but it is also helping people. Now people go to therapy just because someone XYZ on the TV said it.
Said it. Yeah.
So it's becoming a trend though, which is also not something that I'm liking very much. But that is an altogether different topic. But
Yeah.
at least 80% of them get true help.
Yeah.
So getting mental health support is not stigma. It's more painful. Like, keeping your emotions to yourself is more painful than breaking a bone.
Yeah.
But there is no meter that can measure it. But you can actually say ouch when it hurts physically. You cannot
True.
say ouch when you feel sad,
Yeah. Yeah.
right? So please get mental health support whenever, wherever, howsoever you can.
Yeah.
I think that is what that actually sums up whatever I want to say.
Okay. Great.
And with cancer patients, it is all the more important to get mental health support. And
True.
people do worry about spending more money on therapists, whereas they're already spending so much in cancer treatment. Cancer treatment itself is very scarce, especially in rural areas in India. And there are a lot of alternative therapies. There are a lot of sadhu babas and jadoo tonas and hakims and all those people who tend to claim that they can cure cancer forever. So all I have to say is think practically.
Yeah.
Go with what the statistics say rather than what your neighbor said,
Yeah.
and try and be more inclined towards science rather than superstition.
Yeah. Yeah. True. True. Yeah.
Because there have been more losses of patients who could have been absolutely cured with allopathic treatment, who went to some alternative therapies. And I'm not saying that they're wrong or they're bad. I'm absolutely not saying that, but asking, I'm pledging, I'm really requesting people to be scientifically inclined.
Hmm. Hmm. Yeah. Yeah. True. I just agree upon that. Saying that, it was really wonderful to have you. A wonderful conversation. Really enjoyed it. Loved it, to be to be more precise. And was a totally different conversation, unique conversation. I was just like, why not to go upon speaking and speaking, but time has its own limits and we have to stop somewhere. So yeah, so thank you very much. I literally enjoyed it. It was wonderful having you. Thank you very much.
This feeling is absolutely mutual. I really loved your. I'm really awestruck by your
My pleasure.
inquisitivity and your inclination towards the work that you are doing
My
and the
pleasure.
zeal with
Thank
which
you.
you are doing it. And please keep doing so. Please let me know if I could be of help in any way. I'm always there, and it has been an absolute pleasure talking with you.
Yeah, it is my pleasure. Thank you very much, and thank you for those good things. Thank you very much.